from the variant first detected in the UK in this long-term care home in Barrie, Ontario, to that one and the variant first seen in South Africa, present in Alberta, including a case that does not appear travel-related.
Let me be blunt. This now is very concerning.
Those new coronavirus strains are in Canada. One study out of Simon Fraser University says with its higher transmission rates, the variant first found in the UK could be especially dangerous, potentially 20,000 cases per day by March, if no further measures are taken by then. Its authors say governments should act now.
Defining non-essential travel and really limiting it, so reducing the number of international travelers coming back into Canada or coming into Canada. Making sure when people do come that we're a bit stricter about what we ask people to do. Right now we ask people to isolate at home. Household members aren't asked to isolate.
But no new restrictions yet from Ottawa.
Because we already have some of the strongest measures anywhere, one just has to remember that we are reliant on supply chains from around the world.
Some provinces are taking steps. Quebec Provincial Police will make sure returning international travelers respect their quarantine. Like others, that province wants more from Ottawa.
It's time to act. We can either ban non-essential travels or isolate travelers in hotels.
We are going to amend our public health orders to ensure that anyone returning to Manitoba, including Western Canada, must self-isolate for a period of 14 days.
Alberta says not a bad idea, but it won't follow suit just yet.
Again, this is something that can remind us all that traveling outside of our home province right now is not something we should be doing unless for essential purposes.
So Rafi, walk us through what we know about the effectiveness of vaccines against these variants.
There is some cause for optimism there. Moderna and Pfizer both say their vaccines are effective against the new variants, though less so when it comes to the strain first detected in South Africa. Those Simon Fraser experts say some protective measures could be set up for travelers, including vaccinating essential workers such as truck drivers who have to cross borders, Adrienne.
All right, Rafi, we'll be watching. Thank you for this.
You're welcome.
Okay, let's bring in infectious diseases specialist Dr. Zain Chagla now. And Dr. Chagla, help us navigate the risk here. I mean, knowing what we know about how much more contagious these variants are potentially, shouldn't we be tightening up our lives even further?
So it's important to know these viruses and these variants still spread the same way. And realistically, nothing has changed in that standpoint. Yes, when one is exposed, there's a higher risk of getting infected. And so it means that our blind spots, like getting together with individuals even for a short amount of time, may be more risky than they were before. But the same public health principles still apply: masking, better ventilation indoors, outdoors over indoors, physical distancing, getting tested while sick, and excluding yourself while sick. And they still work even with this variant in mind.
Well, except there's still community spread in the country, right? So with the greater risk here, I mean, isn't this a small problem today, but one that could potentially explode in the future?
Yeah, and you look at the example of Ireland, where they had this variant circulating while Christmas season was ongoing and people were out and about. They went through a period of restrictions and a reinforcement of public health measures, and they've seen their cases go down week after week after week. And so, it's a good reminder that public health messaging and public health restrictions do work for this variant if it does get out of control.
Follow the guidelines, I think, is the bottom line here. Dr. Chagla, thank you so much for your time.
No problem.